The COVID-19 pandemic has been a shocking event that has shaken the world, leaving no aspect of life untouched. As we survive through this crisis, it is evident that the aftershocks of this pandemic will be felt for years, if not decades, to come. In this video, we have tried to analyze the COVID-19 aftershocks from multiple aspects. Continued allegations that the COVID-19 epidemic originated with a leak from a government facility in Wuhan, China, have generated disagreement and distrust among scientists, intelligence analysts, and politicians. Many experts believed the overwhelming evidence supporting the notion that the epidemic began from a spontaneous overflow of sick animals sold in a Wuhan market. However, China has impeded efforts to analyze the spillover potential by preventing a neutral assessment in the lab. This year, non-Chinese scientists discovered publicly posted genetic sequences from environmental samples collected at the market by Chinese researchers early in the pandemic. They argued the sequences were consistent with the presence of infected animals at the market and supported the spillover hypothesis. The Chinese team that collected the samples initially denied the presence of the animals and later challenged this result, as did those outside China who believed SARS-CoV-2 originated in a Wuhan facility. In the United States, an effort by 9 federal intelligence agencies to publicly explain their perspectives on the pandemic's origins yielded little clarity. A majority supports natural spillover, but with skepticism. In Congress, Republicans held heated hearings accusing U.S. health authorities of purposefully suppressing a lab leak to conceal U.S. financing for bat coronavirus research at the Wuhan lab, but they provided no concrete evidence. The aftershocks of COVID-19 are likely to reverberate across various aspects of society for years to come. Here's a perspective on some of these aftershocks. Economic impacts. The economic impact of this pandemic will continue to be felt throughout the world. This led to the world's worst economic crisis in more than a century and increased inequality within and between countries. The world economy will shrink by 3.5% in 2020, the worst contraction since the Great Depression of the 1930s. Unemployment has increased. According to the International Labor Organization, ILO, global working hours will decrease by 8.8% in 2020, equivalent to the loss of 255 million full-time jobs. The long-term economic effects are still there and may lead to a significant increase in poverty and injustice. The recovery from this crisis will be uneven, as developing countries and economic groups will live longer. The economic impact of the pandemic has been particularly severe in developing countries, where it has seen a loss of income and increased economic instability in the past. Many households and firms were not prepared to withstand an income shock of that scale and duration, and many were already burdened with unmanageable debt levels prior to the crisis. Global poverty rose for the first time in a generation, and disadvantaged communities experienced disproportionate income losses, resulting in a considerable increase in inequality. Small businesses, informal businesses, and businesses with limited access to formal credit have been hit hard by the loss of income due to this pandemic. The government's short-term response to the crisis was swift and comprehensive, using specific policy tools such as direct monetary support, credit issuance, and central bank asset purchase programs. However, these programs have the unintended consequences of undermining the financial health of borrowers, creating a new problem: the need for more clarity about the true level of credit risk in the market. Effects on health and support systems. The health impact of COVID-19 cannot be ascertained for now. Long COVID gives disturbing vibes, characterized by persistent signs like fatigue, gasping, and confusion. People have been warned by the World Health Organization, WHO, about the long-term unpredictable health consequences of COVID-19, demanding ongoing research and support for survivors. The pandemic has revealed weaknesses and deficiencies in health infrastructure around the world, from a lack of emergency response capacity to shortages of critical medical supplies and staff. Health systems have been stunned and forced to make difficult decisions about resource allocation and care prioritization. In addition, the financial burden caused by the pandemic has strained health budgets and highlighted discrimination in health access, especially in marginalized communities. Looking forward, the aftershocks of COVID-19 are likely to cause significant changes in healthcare delivery and policy. There could be a renewed focus on pandemic preparedness, including investing in infrastructure, keeping essential supplies, and improving surveillance and early warning systems. Telemedicine and digital health technologies, which have flourished rapidly during the pandemic, have the potential to be further integrated into mainstream healthcare, improving access to care and increasing efficiency. Additionally, the The importance of international cooperation to address global health threats has been emphasized. Strengthening cooperation between countries, sharing data and resources, and strengthening pandemic response coordination is critical to reducing future risks. Overall, the ongoing impact of COVID-19 will transform healthcare systems, resulting in new, innovative, and new constraints on healthcare delivery. Effects on mental health. The mental health impacts of COVID-19 were severe and widespread, leaving lasting effects on people around the world. Prolonged anxiety, fear, and isolation worsened existing mental illnesses and sparked new ones. Concerns about health, the economy, and the future elevated anxiety levels, while rates of depression were on the rise as people struggled with loneliness and feelings of loss. A survey by the Kaiser Family Foundation found that 53% of adults in the U.S. reported their mental health had been negatively impacted due to worry and stress over the virus. The sudden shift to remote work and learning had blurred the boundaries between work and home life, leading to burnout and stress. Moreover, unexpected levels of trauma and fatigue were faced by frontline workers, putting additional strain on their mental health. Access to mental health services was also demoralized. Many were finding it difficult to seek help due to financial restrictions. Social injustice has spread, and mental health impacts have also affected marginalized societies disproportionately. Additionally, the ongoing impact of the loss of loved ones due to COVID-19 added to the emotional burden. Addressing the psychological impact of the pandemic must be a top priority as societies strive to recover. Investing in accessible and culturally sensitive mental health support services, promoting resilience-building strategies, and fostering community connections are critical steps to healing our collective psyche post-COVID-19. Educational impacts. The educational aftershocks of COVID-19 are significant. UNESCO has estimated that the education of over 1.6 billion students worldwide was disrupted. The shift to online learning has highlighted the digital divide, with disadvantaged students facing barriers to access. And due to a lack of internet connectivity, information technology, educational materials, and digital technology skills, distance learning has been very difficult for teachers, students, and families in developing countries. Continuous analysis has revealed a sizable drop in students' grades and skills before and after the COVID-19 pandemic. Most of us have never lived through a pandemic, and there is so much we don't know about students' capacity for resiliency in these circumstances and what a timeline for recovery will look like. Educators are now contending with huge new challenges, many outside their control, to cope with the damages done by COVID-19. To minimize the effects of changes brought about in education by COVID-19, every country is trying to make suitable modifications to the education system. However, the long-term effects on students' academic and career prospects are yet to be fully understood. Social impacts. COVID-19 has transformed the social landscape. Even as the world has already seen medical emergencies in earlier eras, COVID-19 represents a watershed event. In the age of the internet, social media, and instant transcontinental communication and mass transportation, COVID-19 was one of its kind, given the degree and swiftness of its spread. It occurred in an age when the global economy was more integrated than ever before, and people, goods, money, and ideas moved faster than they had ever done. Consequently, the effect of a microbial disease with intercontinental spread and fatal potential has affected society more than at any time in the past. Physical distancing measures, while necessary, have led to increased loneliness and isolation. COVID-19 patients also suffered from the social stigma surrounding the disease that manifested in different ways depending on the status of the affected or the care provider. This made the patient reluctant to go back to the community during the infected stage. This could be due to genuine concern about infecting other family members or due to society's apathy towards those infected. The pandemic has also exposed social inequalities, with marginalized communities disproportionately affected by the virus and its consequences. Irritating travel restrictions forced people to stay at home. People found ways to gather electronically rather than physically, which will bring serious changes in society. Aggression has been observed in people who have lost their jobs due to supply and demand fluctuations, but at the same time, people have learned to earn a living online. The aftershocks of COVID-19 are far-reaching and multifaceted, filling every aspect of life. As we move forward, it is essential to learn from this crisis, addressing the vulnerabilities it has exposed and building a stronger, unbiased, and sustainable future. The full impact of these aftershocks will continue to unfold, and it is our collective responsibility to navigate them with care, empathy, and precaution.